Grenada receives first shipment of 1,000 COVID-19 vaccines. We'll have details to this story and more in the National Report. Welcome back. With the details to the news for Wednesday, February 10th, 2021, I am Shere-Ann Noel. Minister for Health Honorable Nicholas Steele on Wednesday received on behalf of the government of Grenada the first 1,000 doses of Astrazeneca vaccines to be administered to 500 frontline workers. The Astrazeneca vaccine, or COVID Shield, is manufactured in India. It was made available through the initiative of Prime Minister Mia Mottley of Barbados, who coordinated the delivery of some of her country's first batch of vaccines to OECS countries. Honorable Steele said this particular vaccine is one of the front runners among those already produced and has been approved for use in the United Kingdom and the European Union. The vaccine also meets the criteria that Grenada has identified for selection. Wednesday, February 10th, Honorable Steele says, marks the beginning of the light at the end of the tunnel, where we hope to see the end of the COVID-19 threat that we have been surviving and dealing with to date.
This first 1,000. Then later on today or tomorrow, we have another 5,000 doses. And then in a couple of weeks, we will have 40,000 doses. Once we know that all processes are there, then we will see more and more coming in until we get to that critical amount of about 60,000 individuals in Grenada receiving the vaccine.
The receiving party included Acting Chief Medical Officer Dr. Sean Charles, Acting Permanent Secretary in the Ministry of Health Dr. Francis Martin, and Dr. George Mitchell, member of the COVID-19 Response Committee. They all made statements that reaffirmed Grenada's capacity to store the vaccines and the importance of it being administered in the fight against the virus.
This vaccine is one that our current system is fully capable of accommodating and distributing using all of the current storage facilities and distribution mechanisms that we've been using over the years for all of the vaccines. This one requires normal temperature for storage, that is between 2 to 8 degrees, and it will go a long way in assisting us in making it available once we get sufficient quantities, making it available to throughout the country.
I am quite happy and pleased that we are at this juncture, because now we will be able to get our persons vaccinated and hopefully help our lives to return to normal, and hopefully also help in the general administration of health to be able to get back to some level of normalcy, helping to open our economy and so on. So it is a very pleasant moment for me. Having been there from the start of the COVID till now, this is probably the best day I've had since the start of COVID.
Vaccines is not anything that is unusual to us. We've been vaccinated from day one. And by all public health standards, vaccination has saved the most lives with all public health measures that has been taken throughout the world. So I want to put up my hand and say, Minister, I want my vaccine, please. I want to be vaccinated. Thank you.
The vaccine was transported by the Regional Security Systems RSS plane. Moving along, Acting Chief Medical Officer Dr. Sean Charles says frontline workers will be the first in line to receive the COVID-19 vaccination. Outlining the order of priority for the vaccination rollout plan on Wednesday, Dr. Charles said law enforcement, customs and immigration officers, accommodation workers, individuals with underlying health conditions, and persons over the age of 65 will also be given top priority.
First, we're going to target populations with significantly elevated risk of being infected. And also, one of the objectives is to protect the continuing functioning of essential services, including health services. As such, our first order of priority would be our frontline staff. All right? Starting with our healthcare staff. And of course, when we speak about healthcare, this includes all persons serving in the healthcare setting who have the potential for direct or indirect exposure to COVID-19. We have to protect those who bear significant additional risk or burdens for of COVID-19 to safeguard the welfare of others. So we have other essential workers, such as law enforcement, and that includes immigration and prisons and so on. We have persons who are employed at nursing homes. We have persons who work in the accommodation sector, at quarantine sites. We have persons who provide services to the aircraft, like cleaning and so on aircraft. We have our airport taxis. All of these are included.
The Astrazeneca vaccine will be administered to healthcare workers as early as next week. During Wednesday's post-cabinet press briefing, Dr. Charles said while taking the vaccine is not mandatory, it is a welcome intervention that he hopes will contain the spread of the virus. He describes it as an additional protection to safety and sanitary measures already in place. This is the National Report. The news will continue after the break.
Are you gonna wear your mask today? You see everywhere you go, there are rules you got to follow, so don't you say COVID-19 will delay. Take the opportunity to save your community. Don't be that guy, put a mask on your face if you're heading outside. It's your life, my life, more lives will be taken if we don't try. If you feel any symptoms, call the hotline. Stay inside until you feel fine. 6 feet away every day. Keep COVID-19 far from away. Keep Grenada safe. Be COVID-19 smart.
Welcome back. Grenada currently has no active or new confirmed cases of COVID-19. However, Minister for Health and Social Security, Honorable Nicholas Steele, says Cabinet has decided that the nightly curfew will remain in place. There will be a change to the time to reflect the nightly curfew of 10 p.m. to 4 a.m. And this is to accommodate farmers, fishermen, and others who engage in early morning activities.
We have recognized, as we have seen with other Caribbean islands and worldwide, that at present, the current strains of COVID-19 are extremely unforgiving. That if you allow complete free movement within your country and COVID does get in, as has been shown, the possibility of it getting in, no matter how strict or stringent our policies are at the border, same with other countries as well, that by the time you pick it up, it is too late to control it. And as such, regrettably, we do need to continue with the curfew from the 10 p.m. It is going to the 4 a.m., as I've said. We hope that there will be a chance in the not too distant future to remove or reduce further the hours of curfew, but it all depends on the threat to Grenada based on the presence of COVID at our borders.
Being able to boast of no new or active COVID-19 cases at this time is testament to Grenada's hard work to keep the country safe. Grenada has conducted 20,819 PCR tests. There were 148 confirmed cases, 147 recoveries, and 1 death. Data was outlined by Chief Medical Officer Dr. Sean Charles during Wednesday's post-cabinet briefing. He provided further updates on Grenada's current status with the global pandemic.
There are no new positive cases. In fact, at present, we have 0 active cases. We have no active cases being monitored and isolated. We have completed a total of 20,819 RT-PCR tests. As I said, we have no one in isolation, and we have 197 persons at various stages in the quarantine process, and these are individuals who have traveled to Grenada, and we will test them once the time has arrived for their test to be done. And to date, we have had a total of 6 persons hospitalized, and of course we have no one at present in hospital. So this is where we stand at present. We have 0 active cases at present in Grenada. I must admit it took a lot of work to get to this point, and we want to say thanks to the public for assisting us along the way in getting to where we are at present.
And finally in the news, the conversation surrounding the urgent need to increase the use of renewable energy and reduce the cost of electricity continues. On Tuesday, the Public Utilities Regulatory Commission, PURC, held the first in a series of public consultations of 2021, geared towards regulating Grenada's electricity sector. The PURC, which is guided by the 2016 Electricity Act, is charged with reducing the national reliance on imported fossil fuel and Grenada's carbon footprint through the supply of electricity from renewable energy resources. Consultations towards lowering the cost of electricity in Grenada began in 2019, but were placed on hold due to the restrictions imposed as a result of COVID-19. Acting Chief Executive Officer Dr. George Matthew emphasized that sustainable electricity means sustainable development. He said the aim is to ensure sustainability, affordability, and to secure electricity for the future.
We are seeking and we want to ensure that the regulations secure our future, right? And a future that we envision, and that's from a policy orientation, and then we have the PURC as the regulating body, basically ensuring that we are in the long term not going to follow the pathway that leads to disorientation, but to follow a green future, right? A green economy in that sense. So basically we want to be free from fuel poverty. So in essence, we want security of electricity supply, and we want to ensure that we are reducing our CO2 emissions, and that's what ties into a nationally determined contribution or sustainability, the 2035 goals that we have and the 2030 goals, right? In essence, your sustainable electricity means that you have sustainable development. So if we have an electricity supply that is affordable, secure, sustainable, we know for sure that in the long term, Grenada and Grenadians would benefit a lot because we're going to have a lot of sustainable development taking place.
Engineer Davrel Bowler says Grenada has huge sustainable renewable energy potential, which with investment can reduce the dependence on fossil fuel and lower the cost of electricity.
Geothermal, wind, including offshore, and solar resources. The potential renewable energy capacity is estimated at 120.5 megawatts, including 50 megawatts of geothermal, 50 megawatts of solar, 20 megawatts of wind energy, and 0.5 megawatts of hydro. Therefore, the power sector has the potential to diversify its generation mix through investment and scale up on renewables and reduce the dependence on imported fossil fuels and lower electricity costs. Now, I know there is a unidimensional thinking when we refer to Grenadian renewables, where a lot of people are eager to jump to solar. But as we can see here, our sun-kissed land of smiles is not just solar. There's a lot of opportunity for other means of renewables.
And with that story, we come to the end of the National Report for Wednesday, February 10th, 2021. Now for a recap of the top story. Grenada receives first shipment of 1,000 COVID-19 vaccines. On behalf of the entire news and production team, I am Shere-Ann Noel, thanking you for viewing.